my experience of the NHS, to be quite honest, I probably wouldn't be here if it wasn't for them. I'm so well looked after. My medication, they check up on me, make sure I'm taking the right things. I'd probably be lost without them.
The Elm team comprises of myself as community matron. We have 2 community sisters and the whole-time equivalent of 4 community staff nurses and 2 healthcare assistants. Assigned to our team is also an occupational therapist and physiotherapist. We also have 2 community psychiatric nurses assigned to our team as well, and hoping to build bridges and continue further with adult services so we can get a social worker on board. The need for a social worker would definitely enhance the team further, and it's something that we're hoping that will happen in the future.
Having COPD is a hell of a restriction on my life. I love walking, which I can't do. I played football for 30 years, which I wouldn't even dream of now. And just like I have a big family, I'm one of 10. And there's a lot of social events. If there's stairs involved, I won't go, because I know I won't go up the stairs. And the wheelchair thing, again, which I don't like, it takes over your life, really. The asthma part of it, definitely in the family. So it's definitely genetic. I just hope none of my grandchildren get it. Well, the diabetes, I think was brought on by the amount of steroids over the years. And it started, I think it was about 5 years ago. I didn't even realise I had it, and I went in the hospital and they took the sugars and it was 30 something. And that was the start of it. And I take the insulin 4 times a day.
John has several long-term conditions which obviously affect his health, and he is aware that because they're long-term conditions, they're something that he has to live with for the rest of his life. As such, he doesn't have a formal structured care package, but relies very heavily on his wife Alison to provide a lot of social and personal care for him, and it's something they both decided that's the way they want his care to be delivered within the home. Alison does a lot of care for him, and I think John freely admits that he didn't have Alison in his life, he would really struggle to be at home.
We've been married 40 years, still the best girl I've ever met. We've got 2 great kids and 5 lovely grandchildren, which I look forward to seeing every Saturday. Most days I can cope with things. I can get up, have a wash, get dressed. Then the next day I might not be able to do any of that. So she would actually help me before she sets off for work. She'd help me have a shower, get dressed, do whatever I was going to have to eat. I don't know, at times I don't know what I would do without her. When we go anywhere, if there's walking involved, I use a wheelchair, which I hate. And she'll push me quite willingly.
The care he receives, he's got very good rapport with the GP, who knows John very, very well. And I found the GPs are very quick to respond to any queries or problems I have or worries with John and his condition, and are very helpful and facilitative and will listen to what I have to say and respond accordingly. John also receives specialist input from a respiratory physiotherapist with special interest, and he's under the respiratory team as well. He has a respiratory nurse see him. He's currently under the hospital under several departments for his conditions. So there's much more integration going on between the community, primary and acute services.
What I get from the NHS is loads and loads of medication. I've had physio in the past, George Spiteri's come and visit me. I have Penny Parsons comes round. Again, depending how ill or not ill I am, it could be 4 weeks, it could be 6 weeks. But again, she's always on call if I do need anything. My own doctor, Dr. Foley, well, all the doctors in my surgery are very good. Same with Penny. I get as much care as I can. You know, they're very good. I'm quite lucky where I live, the care that I do get.
The role of the community matron with integrated care, I think, is the word, it brings everything together. The person that was the link between acute care, the community services, primary care and specialist services. Someone the patient had one port of call where they could go to rather than having to be bounced around lots of different services, with the idea to streamline and make their care better for them. Funny enough, the barriers and challenges that we need to address for future use in integrated care, I think we certainly need to streamline and improve our communication systems. And a certain frustration that we feel is that we're all talking and using different IT technology, which is not speaking to one another. And the frustration is that the patient is at the centre of this and is not always getting the most prompt or appropriate care because the communication systems aren't in place properly.